Hi, my name is Greg Fell. I'm Director of Public Health in Sheffield. This is the situation update as of today, the 30th of November. Firstly, the epidemiology. So the seven-day incidence is significantly less than 200 per 100,000 now. As of yesterday, it was about 180 per 100,000 and continuing to fall. Second or third lowest in the region, which is clearly great news. About 8,500 people a week get tested, or 8,500 people with symptoms a week get tested, and that turns into in the order of about 200 people test positive a day, a bit less than that, so about 1,400 positive tests in any given week. That's coming down. We are continuing to ask people that have even mild symptoms to get tested. That's by far and away the most important thing that we can do to reduce transmission, is to get on top of symptoms and then all of the things that follow, and then to test as quickly as possible and get a result back as quickly as possible. So incidence is continuing to fall. It's falling in all age groups apart from secondary school age children, where it's steady. It's not going up or decreasing. It's holding fairly steady. As we get towards the end of term, obviously that will fall because children won't be in school. R naught is just less than 1. It's 0.9, and that's a good place to be. That means the epidemic is shrinking. So for 100 people who have the infection, they will pass that on to 90 others. So you can see the maths is pretty simple. That continues to shrink. Our preference would be that R naught is a long way below 1, but we're not going to get there by the 2nd of December, which is a couple of days away now. But it is below 1. There's no doubt about the fact it's below 1, and it's below 1 because a lot of people have done the right thing over a long period in time. Hospitals remain busy. Activity in hospitals on account of COVID is flat and beginning to fall, but falling from a really high rate of activity. So there's relatively little room for manoeuvre there. One of the things that we can't afford to do is anything that will increase the number of cases, which are, as I say, currently coming down. But if we increase the number of cases, that will invariably end in more people being hospitalised, and that puts pressure on a really very busy hospital system. So whilst activity in hospitals is coming down, it's coming down quite slowly, and it's coming down from quite a high level of activity, particularly given all of the other things the NHS is doing at this time of year. Deaths from COVID have risen and are beginning to plateau, probably a little bit too soon to call. So all up, all of the signals and indicators from the epidemiology are all going in the right direction and continue to do so. I don't anticipate that will change any time in the next few weeks. R naught is the key measure, which is below 1. That was the stated aim of the national lockdown, and we've achieved that aim. But we've got relatively little room for manoeuvre. Whilst rates are coming down, they're coming down from quite a high rate. R naught is only just below 1, so the potential is for further takeoff, and that could happen really quite quickly. So we're still a long way from being out of the woods. Next up, we continue the strategy that we've set. So the strategy covers a whole range of activity: prevention, enforcement, testing, contact tracing, isolation, management of incidents, so that clusters don't become outbreaks don't become big outbreaks. So that will continue. That strategy has been set and has definitely been the right strategy, and will continue that certainly for the foreseeable future. So we will be in Tier 3 from the 2nd of December, and then we know that. We will be looking forward to the next review period, which will be in mid-December, and we'll see where we end up. There's a possibility we may be in Tier 2, but it's too soon to call that one way or the other. The next few weeks for our team is going to be very focused on doing all we can to support the NHS in its activity to prepare for vaccination. We anticipate we'll be beginning to vaccinate in earnest, possibly this calendar year, but certainly in 2021, early 2021, preparing to use the new tests, lateral flow tests, in those people, in defined cohorts of people who don't have symptoms, and preparing for Christmas. Clearly Christmas is coming, and whilst we all want to celebrate, we need to be mindful the more mixing with the more people, that will lead to an increase in cases, and we need to be prepared for that and to risk manage that as best we possibly can. So epidemiology is going the right way. The strategy will remain the strategy. There are always new challenges ahead, and thank you to Sheffielders for continuing to do the right thing, because you can see that the impact of that has and will save lives, and please continue to wash your hands, keep your distance and wear your face coverings.